treatment is the most important. It's very tricky because parents have a lots of uh, question about it. First of it, they don't want to accept it. Second, if they accept it, they won't ready to continue treatment for the long time. They may say if you give enema and if child is able to pass the motion, then constipation is clear. So that is not a thing. There is a loss of fecal matter inside the bowel, and we need to remove it. So basically, after ruling out all these serious conditions, we need to focus on the two things. First is disinfection, and second is a maintenance. Disinfection means what is the best way is to explain the parents with the drawing the GI diagram or do one tummy X-ray. I know a tummy X-ray is not recommended, but in general, if I have to do, I take a help of tummy X-ray or I do the GI diagram and tell them that there are lots of fecal matter inside the body and we need to remove it by slowly with the enterogated enema. Like see the when we are giving some enema, it just clear the rectum. It don't create the ascending bowel, descending bowel or transverse bowel. It is possible in the functional constipation in the long-term entity and the loss of fecal material may be there. So we need to give a first-line medicine is a polyethylene glycol, uh, polyethylene glycol or a lactulose or a lexitol, which are the osmotic diuretic. So we need to give it to the long time. The polyethylene glycol dose we see that 2 gram per kg, 1 to 2 gram per kg, and we need to monitor the dose according to the frequency of the stool. Maximum maximum or minimum 2 stool per day we need to give that particular dose. So I we need to counsel that this molecule maybe need to continue at least for the 4 week for the proper disinfection 2 to 4 week, and based on response we might extend it also. The wise and tell them that there is a very less side effect and no dependency, because parents is a fear what if child become dependent on this medicine. Yeah, and meanwhile, frequently also assess the toilet training. If you find that there is a defect in toilet training, you can refer to the specialist, because without proper toilet training, without dietary modification, without uh, physical activity, so these things not work, because the sometimes if the child is not properly toilet trained, this kind of medicine won't going to work, right? If he passing the motion by standing only so that a sphincter are not going to release properly. So it may cause a bottleneck effect, and it may cause the constipation, right? And the third is then the maintenance phase. Maintenance phase we continue for up to 6 months also. And if the child is able to toilet training, then that is fine. But the focus is on the regular toilet training, uh, loss of liquid, proper physical activities, and if required, we can do the some washroom modification regarding the child. And better we say that tell the child do not to afraid from the washroom, because sometimes what happen when the kids is younger, we are all tell them it is a ganda, dirty. So sometimes they consciously avoid it. I don't want to go. Why? Because it's a dirty place. I don't want to go there. Tell them that we eat 3 times a day. We have to go once a day. We need to remove uh, all our waste from the body via this only. So sometimes a good talk, a good bonding, you need to teach them. A good basic skill teaching will help them. These are all necessary. And many times we have seen that once we treat the constipation, child start the eating properly, child start the behaving properly, their bedwetting problem uh, decreases. So most of time is a constipation. Next one. Yeah, see, just I mentioned you. Yeah, so one more thing. When you are starting the disinfection, in the first or second week, child may pass a loss of loose motion. Yeah, again I mentioned to you, it is mostly because the semi-solid stool infected within the large intestine. So tell them don't stop this medicine. Sometimes what happen, sir, we are giving this medicine and it started with diarrhea, so we feel that constipation and get treated. So this should be mentioned. That's why we have mentioned with the red. Warn the parents with that disinfection may initially increase the symptoms of swelling and abdomen. Next one. Yeah, so the thing is that yeah, the disease is most important. because we parents should have insight into the illness. If they don't accept that their kid is a constipation, they won't follow a compliance. So what to do? Like, are they non-medical? We need to see all these things like toilet training issue, toilet behavior, which reward they are using, any unpleasant experience during toilet training, are the challenge withholding toilet because stool toilet is not clean. See that I told you that kids are very hygienic and they behave, they try to avoid the dirty places. Are there any other emotional issue difficulties from sometimes because of emotional and they are not doing it? Educate about the constipation, give them the written information. Diet and food is mostly important. Let family know it is a chronic condition. See, the parents want the miracle treatment. That is not possible. It may take minimum 6 months. And about the medicine, sometimes they have lots of misconception about the medicine. And kid also don't like the medicine. Mostly the if we go the polyethylene glycol powder, so initially they give it water to many kids don't like the taste with the water. Or sometimes we can ask you can add some juices also. And the thing is that the regular consistent use of medicine with lifestyle modification polyethylene is the key to treat the functional constipation. It should be done continuously in synchronization. If you're doing one thing and if you're not following other thing, your problem is not gonna solve. So basic is a counseling and their family habits need to modification of the family habit is necessary. I think that's all from my side from the constipation. If you want to ask any question, we can discuss it. Yeah, see, don't be afraid to give high dose of medication. See, there is a nice guidelines and American academic pediatric, like we can give up to 4 gram per kg polyethylene glycol, and sometimes maintenance dose also have to give it a long time, right? And regular follow up is necessary. Yeah. So any questions? Yeah, these are some summaries. Common, recognize and treat early diarrhea, maybe overflow due to severe constipation. Proper treatment, workout, engage the parents, and reuse keep processing message.